Hi everyone, it's Irma back again. I'm sorry I've been a little, I haven't posted a video in about a week or so. As you know, the holidays have come and gone. Just wanted to come and make another video. Thank you for all my new subscribers that I've gotten over the past few days. I really didn't know if anybody was actually even watching my videos, if it was just me just recording these for my personal just for myself and just to, like I keep saying, look back on as I mature as a nurse. But thank you for all your subscribers. I'm happy to have subscribers just so I can communicate with people who are my situation, who are graduate nurses, who are about to be graduate nurses. If you're in nursing school, in all areas of nursing, it's great to have people to talk to who understand you. That's great. I want to make this video talking about. I know it's been a little while, and I never made a follow-up video about my interview. Because when I was researching graduate nurse interviews, what questions are common, some tips, I found a couple of videos, but there wasn't a lot of personal experience with their interviews, if you know what I mean. So basically what I did this past few days, I've been trying to think back on my interview, and I wrote down questions that I kind of remember from my interview, but I should have done this video a while back. Then I got busy studying for NCLEX and the holidays, and then busy with other personal things that I got lost. But basically, let me do this back. Basically, let me say I interviewed here at my local children's hospital I applied at the end of November, and interviews were going to be held at the beginning of December. So then I did my interview, I think it was like, it was on a Wednesday, and it was like the second or third, I can't really remember what day it was. So I interviewed, and basically it was 2 interviews. Like I said, I think in my other video, I kind of had a getting ready to go to my interview day. I recorded before, and then I did a video afterwards, kind of giving some questions, but not really going into more detail. And I never followed up about if I got the job or not. I don't think I did. Basically, that was on a Wednesday, right? And so then I interviewed with the nurse managers and then with the staff on the different floors. That was on a Wednesday. It took about 45 minutes to an hour. Um, yeah, it was. I was just happy that I prepared. I really think my interview answering and my energy and my enthusiasm really helped me get the position. That's the first thing I want to say. Basically, they called me the next day on a Thursday. They called me around 5 or 6 in the afternoon. And at first I didn't know the number, so I don't really like answering numbers that I don't know. If they need me, they'll leave me a voicemail if it's important. And they did. They left me a voicemail. Basically, it was the personnel from HR, and they wanted me to call them. So I called them back, and she basically offered me a position in their graduate nurse program, which is 6 months long, very tedious, but very beneficial to transition specifically into the area that they hired me into. So basically, they hired a certain number of applicants into the graduate nurse program, and for us, they hired 7 girls, or yeah, 7 applicants, and they're basically going to split us up into the different areas. So they asked me if I was interested in working in NICU, and of course I was scared, but I knew that working with babies anywhere is really what I'm supposed to be doing. So I really wanted to get my foot in the door and just start with babies, and I didn't even know they hired graduate nurses into the NICU. So I was like all for it. I was ecstatic that I finally found a job after about 4 or 5 months of searching. So that was such a blessing. So, like I said, being prepared for the interview, I do believe landed me the job. I'm gonna try not to make this video so long, but if it is long, I might do 2 parts, maybe. So, first, I kind of want to talk about preparing to apply for graduate nurse programs or any jobs. For this specific hospital, they wanted graduates who had at least a 3.0 GPA. So thankfully, I wasn't a 4.0, no way. I have a good average. So that's another thing. In nursing school, you want to of course, everybody wants to strive for A's, but you definitely want to try your best. And at some classes, I was like, just give me a C. I don't care, just give me a C. But really, you really want to try your best. And yes, you want to pass, but you want to aim for A's and B's to kind of level out your GPA. That's my first tip, obviously, just to try your best in nursing school and try to get at least a 3.0 because a lot of graduate nurse programs only accept 3.0s or higher for certain programs. Another one is while in nursing school, I do suggest to be part of some nursing organization. In our school, we had Student Nurses Association or SNA, and we paid to be part of it, but it really looks good on your resume that you were a part of some sort of nursing organization. And also, after you graduate and you are a RN, I am planning to be a part of the AMA, yeah, the American Nurses Association, or even some OB association. I know there's a lot of associations just for the specialty you're in that also looks really good on your resume. I would say also volunteer hours. If you have, I know you have time. If you're a pre-nursing student, or even a early nursing student, you want to do volunteer hours. I have a lot of volunteer hours, but it's for my Student Nurses Association. We did a lot of health fairs. We did a lot of first aid stations, a lot of diabetes walks, cancer walks, anything health related and volunteering is amazing. If you want to volunteer a few weeks out of the summer at your local hospitals as a volunteer, that looks really great. Especially if you volunteer in the hospital that you're applying for. Kudos, right? So that's another tip I have. On your resume, you also want to put if you speak another language. I speak Spanish, so down here in South Texas, that was a great plus. In the interview, I kind of forgot to mention it, but it's on my resume. And right before I walked out the door, one of the ladies asked me if I spoke Spanish, and I said, yeah, I can speak, read, write, listen, anything. I'm really fluent in Spanish, so that is a great thing if you know how to speak another language, if you can speak sign language, anything. It looks great on your resume because they always want staff who can speak more than one language because there's so many different types of people, different types of patients that come into the doors. And for me, it's going to be a lot of families, a lot of Spanish-speaking families who come in to this hospital. So, I mean, I can talk to them and teach them and understand them, and our relationship can grow so much better since I understand them. Another tip for interview is just how you present yourself and your energy. Yes, I was so nervous, and at first I could feel myself cracking answering questions because I was nervous. But after I got comfortable, I was really energetic and just smiling and looking. When I was answering, I would make eye contact. I would try to answer the person's questions and look around after I answered just to make sure to see the response for my response, if that makes sense. Just smiling and just being real energetic about the position, saying, yes, I really want this. This is my dream job. Even if it's not your dream job, but if you really want a job, just sell yourself, you know? So I basically was like real smiling and happy and saying, I was just nodding at the questions, and then I would think about what I was going to say as I was listening to the questions. I'm like, okay, well, to answer this, I would say this. I'm going to say examples. This video is getting kind of long, so I might have to do 2 videos. Also, let them know that you're flexible in hours. As a new grad, I went in, okay, if I have to work nights, I don't really want to work nights, but I can learn more nights. It's slower paced. So I don't know if I'm working nights or days, but I let them know that I was so flexible. I don't have any kids. I have a husband, but he can take care of himself. I don't have any other, like, this is going to be my first job, and I'm so dedicated. I will be so dedicated in this job and so committed, and just go in with 110% basically is what I let them know, is I'm really ready to work and ready to learn. And they love that response. Another key word that you want to keep repeating in the interview that I knew in this interview I needed to say, because I got help from past people who are in this program right now. They told me just to say that you are a team player. They love that response. So team player, keep putting that in there in every response, and they like it. Those are just some tips I have. So I guess I'll name this interview, think about interview part 1, and then I'll go more in depth in the next video about the questions they asked me and what I answered to them. Okay? Keep watching, guys.